Has your senior dog peed on the carpet again? How many times has that been this week already? I get it. I know exactly how you feel. I would walk in the door and I had like radar. I would laser focus on that pee stain. Drove me crazy. But what else is your dog doing that is not typical? Let's see. Is he wandering around, kind of seeming confused? Does seems more withdrawn than normal, not really interested in participating with the family or playing. How about anxiety? Has he become a lot more anxious, maybe even aggressive, which is absolutely not something you ever thought you would see? Well, don't worry, because I may have some answers for you. Hi everyone, I'm Hindi. I started Great Paws and All. Today I wanted to talk about dementia, also known as canine cognitive dysfunction. Now, some of the signs, there are a lot of different signs, and I mentioned already quite a few, but also things like standing on the wrong side of the door, not eating or drinking well. It's like they forgot how to eat and drink, or they can't find their bowls. Their sleep wake patterns are all mixed up. They tend to sleep more during the day, and they're up all night. They're not settling. There's a whole bunch more. I'm going to link an article that I wrote about this in the description below, and I recommend you read it. The thing about dementia is um, there's no way to actually diagnose it. It's a process of elimination, and a lot of vets don't mention it. I have the most fantastic vet, and he never even thought of dementia. I did, thankfully. A lot of plane going overhead. Sorry about that. A lot of the symptoms are similar to other illnesses. So, for example, if your dog has been peeing on the carpet a lot, maybe he or she has a UTI, a urinary tract infection, or kidney problems. If he's not eating, that could be nausea. You see where I'm going with this? So, a lot of the symptoms are similar, and because there isn't one test, a lot of vets just say, oh, it's old age. Let me mention that quickly. If you ever go to your vet and you have a concern, even if you can't quite put your finger on it, you feel just something is not right, and your vet dismisses you and says your dog is old, see another vet. Anyway, back to the discussion on dementia. I want to mention that in those articles that I'm talking about that are linked below, there are there's a very extensive list of symptoms you may be seeing, and a downloadable printable checklist that you can take to your vet, which will be very helpful in terms of diagnosis. Okay, so now we know some of the symptoms we look for. Take your dog to the vet, take the checklist with you. Now, if your vet does not mention dementia, please mention it, but make sure he does urine tests and blood tests just to eliminate all other possible causes. And if you find that all the tests come back fine, but the symptoms are persisting, it's probably dementia. Now, they don't always mention the name of the medication that could possibly help, because many don't believe it helps enough dogs. The way I see it, it has to help your dog, and to be honest, it helped mine a lot for about a year. The medication is called selegiline, which is Anapril in the US and Canada, and Celgin in the UK. So I would mention that to the vet. Dementia is progressive, so it could be that it's too far along for it to work, but you know what? It's worth a try. Now, there are other things you can do to treat it. That helps theoretically helps slow the progression of dementia. The other things that are out there that you could try are really for the symptoms like anxiety, for instance. So, dog calming chews, or a calming medication from your vet. The Adaptil plug-in or spray that could help. Melatonin could help with the disturbance of the sleep-wake cycle. Something that worked brilliantly for us was Through a Dog's Ear. It's music. It's classical music and it is tailor made for dogs. There are a lot. Just type in dog calming music into YouTube, you'll find a lot. The only I only tried one through a dog's ear. I will show you which one. I'll link it below. There's a 12-minute sampler on YouTube. I mean, you don't need to buy that. It's just the one that worked well for my dog, and I didn't want to change it because she would literally wander for hours, and within 30 seconds she'd be resting. And me too. It's that calming. So there are lots of things you can do to help manage the symptoms, and something like keeping to a routine is very helpful, because when your dog, anyway, it's advisable to have a routine no matter how old, but dementia dogs do well with routine because they know what's happening when. Anyway, don't worry. I know it's been stressful. Oh, sorry, one other thing. I got tired of coming home. No matter how many times I took Red out, I mean, poor thing, she just didn't remember. So I'd have lots of accidents. I couldn't stand it anymore. So I covered my entire floor in pee pads. Yeah, my husband didn't like it. It looked terrible. But you know what? I was so much more relaxed because you throw out the pee pad and you do what you have to do to take care of your amazing senior dogs. Anyway, that's it for this video. I hope you found it helpful. If you are dealing with something similar with your dog, or if you know your dog has already been diagnosed with dementia, share your story below. You know, we're here to support you. And if you have any great tips that have worked for your dog in terms of relaxation, helping him find his way around, I mean, you know what? We all learn from each other. And don't forget to take care of yourself. Caregiver burnout is a real thing. Anyway, thank you so much for watching. Subscribe and get notified when I have new videos, which come out regularly. And I will see you in the next video. Have a wonderful day, everybody.